Hey everyone, welcome back to Speak Healthy. Today we are getting into the nitty-gritty regarding chronic kidney disease. Chronic kidney disease, also known as CKD, is a condition that affects millions of people around the world, yet many remain unaware of its prevalence and severity. CKD is a progressive disease that can lead to kidney failure, which requires dialysis or a kidney transplant to sustain life. However, there are many misconceptions about CKD, and understanding the truth about the disease is crucial to prevent its progression and improve outcomes for those affected. Today, we will explore the reality of CKD, including its causes, symptoms, risk factors, and treatment options with the aim of increasing awareness and promoting early detection and intervention. Number 1. What is chronic kidney disease? Chronic kidney disease, CKD, is a condition in which the kidneys gradually lose their function over time, leading to a buildup of waste and fluid in the body. CKD is typically diagnosed when kidney function falls below a certain level, as measured by the estimated glomerular filtration rate, which is a calculation based on blood creatinine levels, age, gender, and race. The eGFR reflects the number of milliliters of blood that are filtered by the kidneys each minute, and it is classified into different stages of severity, ranging from stage 1 to stage 5. In addition to the eGFR, the presence of albuminuria, or excess protein in the urine, is also used to classify CKD stages. Albuminuria is a marker of kidney damage and a predictor of future kidney function decline and cardiovascular risk. Based on the combination of eGFR and albuminuria, CKD is classified into 5 stages, from stage 1 to stage 5, with each stage indicating a progressively higher risk of adverse outcomes. It is worth noting that CKD is a silent disease, meaning that it often has no symptoms in its early stages, and the loss of kidney function can go unnoticed for years. For this reason, screening and early detection are critical to prevent CKD progression and improve outcomes for patients. Early intervention with lifestyle changes, medication, and monitoring can slow down or halt the progression of the disease, while advanced CKD may require more aggressive treatments such as dialysis or kidney transplant. Number 2. Prevalence. Chronic kidney disease is a global public health issue that affects millions of people worldwide, and its prevalence has been increasing over the years. According to the Global Burden of Disease Study, CKD was the 12th leading cause of death globally in 2019, accounting for 1.3 million deaths, and the 7th leading cause of years lived with disability, with 28.5 million YLDs. The prevalence of CKD varies across regions and countries, with the highest burden observed in low and middle income countries. In these settings, CKD is often related to infectious diseases such as HIV and hepatitis B and C, as well as to environmental factors such as exposure to toxins and pollutants. In high-income countries, CKD is more commonly associated with non-communicable diseases such as diabetes and hypertension, as well as with aging and lifestyle factors. In terms of affected populations, CKD disproportionately affects certain groups, including older adults, men, and individuals from certain racial and ethnic groups. For example, the prevalence of CKD is higher in African Americans, Hispanics, and Native Americans compared to non-Hispanic whites, even after adjusting for age, sex, and comorbidities. This disparity is thought to be related to the differences in genetic susceptibility, environmental exposures, and access to healthcare. Number 3. Causes and risk factors. Chronic kidney disease can have many causes, and it is often results from a combination of factors. Some of the most common causes of CKD include diabetes, hypertension, glomerulonephritis, and polycystic kidney disease. Diabetes is the leading cause of CKD in developed countries and occurs when high blood sugar levels damage the tiny blood vessels in the kidneys, impairing their function over time. Hypertension, or high blood pressure, is another major cause of CKD, as it damages the small blood vessels and filters in the kidneys, leading to reduced kidney function. Glomerulonephritis, a type of kidney inflammation, can also cause CKD, as it damages the filtering units of the kidneys, leading to scarring and reduced kidney function. Polycystic kidney disease is a genetic condition that causes the formation of fluid-filled cysts in the kidneys, leading to reduced kidney function over time. In addition to these specific causes, there are several risk factors that increase the likelihood of developing CKD. Lifestyle factors such as smoking, poor diet, and physical inactivity can increase the risk of CKD, as they can lead to the development of diabetes and hypertension, which are major causes of the disease. Other risk factors include genetic predisposition, as some individuals may be more susceptible to developing CKD due to their family history and comorbidities such as heart disease and obesity, which can contribute to the development and progression of CKD. It is important to note that some of populations are at a higher risk of developing CKD than others. For example, African Americans, Hispanics, and Native Americans are at a higher risk of developing CKD compared to non-Hispanic whites due to higher rates of diabetes, hypertension, and other comorbidities. Age is another risk factor, as kidney function naturally declines with age, and older adults are at a higher risk of developing CKD. Early detection and intervention can help prevent or delay the progression of CKD, particularly in high-risk populations. Number 4. Symptoms and complications. CKD can be a silent disease, with many people experiencing no symptoms in the early stages. However, as the disease progresses, patients may experience a variety of symptoms, including fatigue, nausea, vomiting, loss of appetite, edema, and changes in urination patterns. These symptoms can be caused by a buildup of waste and fluids in the body, which the kidneys are no longer able to filter properly. As CKD progresses, it can also lead to a range of potential complications. One common complication is anemia, which occurs when the kidneys are no longer able to produce enough red blood cells. This can lead to a fatigue, weakness, and shortness of breath. CKD can also cause bone disease, as the kidneys play a key role in regulating the levels of calcium and phosphorus in the body. As CKD progresses, bones can become weak and brittle, increasing the risk of fractures and other injuries. Another potential complication of CKD is cardiovascular disease, which is the leading cause of death in patients with CKD. As the kidneys fail, they become less able to regulate blood pressure and remove excess fluids from the body, which can put additional strain on the heart and lead to an increased risk of heart attack, stroke, and other cardiovascular events. Other complications of CKD can include neuropathy, cognitive impairment, and infertility. However, with appropriate treatment and management, many of these complications can be prevented or delayed, and patients with CKD can maintain a good quality of life. Treatment options may include medications to control blood pressure and blood sugar, dietary changes to manage electrolyte and fluid balance, and dialysis or kidney transplant in advanced stages of the disease. Number 5. Diagnosis. The diagnosis of CKD involves several tests and assessments. One of the most important tests is the estimated glomerular filtration rate, eGFR, which measures how well the kidneys are filtering waste from the blood. A blood test is used to determine the eGFR, which takes into account age, gender, and serum creatinine levels. If the eGFR is below 60 milliliters per minute for more than 3 months, this indicates reduced kidney function and a diagnosis of CKD. Urine tests are also an important diagnostic tool for CKD. A urine analysis can help identify the presence of protein and other abnormalities in the urine, which can be a sign of kidney damage. A 24-hour urine collection can also be used to measure the amount of protein excreted in the urine and determine the stage of CKD. Imaging studies such as ultrasound or CT scans can be used to assess the size and shape of the kidneys and identify any structural abnormalities that may be contributing to CKD. Early detection of CKD is crucial for effective management of the disease, and screening high-risk populations is important for identifying individuals who may be at risk. High-risk populations may include individuals with a family history of kidney disease, those with diabetes or hypertension, and older adults. Regular blood pressure and blood sugar monitoring can also help detect the early stages of CKD. It is recommended that individuals at risk for CKD undergo annual screening with a blood test for eGFR and a urine analysis to detect any abnormalities. Timely diagnosis and appropriate management can help slow the progression of CKD and reduce the risk of complications. Number 6. Treatment and management. CKD is a progressive condition, and there is no cure for the disease. However, appropriate treatment and management can help slow the progression of CKD and improve the quality of life for patients. The treatment options for CKD vary depending on the stage of the disease and the individual's patient's needs. Medications may be used to manage underlying conditions that contribute to CKD, such as high blood pressure or diabetes. In later stages of CKD, medications may be used to manage complications such as anemia or bone disease. Lifestyle changes are also an important part of CKD management. Patients with CKD may be advised to follow a low-protein diet to reduce the amount of waste products that kidneys need to filter. They may also be advised to limit sodium and phosphorus intake to help manage fluid and electrolyte imbalance. Regular exercise and weight management may also be recommended to help manage underlying conditions such as diabetes and high blood pressure. In advanced stages of CKD, dialysis or kidney transplant may be necessary. Dialysis involves using a machine to filter waste products and excess fluid from the blood, while kidney transplant involves replacing a diseased kidney with a healthy kidney from a donor. It is important to note that CKD management should be individualized based on disease stage, comorbidities, and patient preferences. A multidisciplinary team of healthcare professionals, including nephrologists, dietitians, and social workers, can work together to develop a personalized care plan for each patient.